It is good to talk candidly. You see, the government does not just stop there. And as Brian is saying, we did not just stop where we are talking about dialysis. We have gone beyond there. If you look at, there is a building that is next to traffic, Nairobi area, around Gong Road. Yeah. It's called East African Kidney Institute. We are establishing a kidney institute that will sort out issues of dialysis. What has the ministry done? Initially, when we were talking about transplant, we are having a challenge, even matching the donors. From the recipient to the donor, it used to take like a month because we had to send samples even out of the country so that you can match the donors. What has we done? We have now a state-of-the-art HLA lab, which can actually test compatibility of donors. 2, we did phase 1 of Yaki, which was to upgrade. We have theaters ready for transplants. Now we can actually, even if we are able to do transplant, we can even be able to do 3, 4, 5 transplants in a week. That again has been facilitated. Again, Ayub, from the report you are saying through Parliament. It pointed that time, and the government did not stop there. We have been pushing on up to where we are now. We can do transplant. Now, what has SHA come to do? Now, SHA will do the funding. Now we have, the challenge has been paying. So people have been raising funds, they go to India. What we are saying now, we have the facility, we have the labs to test the compatibility of the patients, and now we can start doing the transplants. The human resource, we have had training. We even, as we talk now, Ayub, Yaki has even PhD students who are supposed to be taking care and learning how to take renal diseases in more serious. What we are saying is that the government has not just stopped there. There is something that is being done, and the area we put that information across. And now what SHA has come now, and Brian, I want, now that you said you are the devil's advocate, I want you to connect the dots. What the challenge has been payment, people affordability, and then sustainability. And we were saying here, you and now, even after the transplant, what has been debilitating is the post-transplant management. So what are we doing as a ministry, as a government? We've had this conversation where, and I was just telling you earlier, we are talking about getting medicines available at an affordable and cheaper rate, so that me, Kirwa, Dagane, and Kemsa, we can have a candid discussion so that we either acquire those medicine in an economy of scale at a very low price, and if you heard what HE was doing, His Excellency, we are talking about local manufacturing, such that some of these drugs now will be so much available here in a very low price. With that, we can, even the package that is being given 200,000 post-transplant, that money will be adequate. So, Brian, what we are talking about, this is a candid discussion that must be discussed. Yes. And even KEMSA must come in so that we can talk about end-to-end service, from the drug up to where we can follow, we can track that drug, who used the drug, who swallowed it, at what point. And this is a candid, that this is a discussion we don't want to leave it, that it's a SHA business. Okay. It must be a corrective responsibility. Yes,